in healthcare specifically, is a new category. It's very hard for people to imagine the possibilities, and especially true if, again, as you mentioned, the user is not the main beneficiary sometimes. A lot of our work was data-driven extraction of value. You know, you have this saying, if you build it, they will come. I found that to be untrue. You have to build it, but you also have to show the value and be able to extract it. So if I think about AI, the loop for AI for healthcare, it's you have to find the patients, then you have to generate an action on those patients. Just finding the patient isn't sufficient. So find, act, but then measure. Find, act, and measure. And if you don't have the full loop, then you can either find the patients, but nothing happens with them, so nobody cares, or you actually act, but nobody knows what the value is. So the ability to measure the value was a very important facet of the adoption.
I'm hearing three things so far. So you talked about necessity to focus on scale from day one. And that kind of immediately leads you away from point solutions and into something bigger, into system solutions. The second point that you mentioned is always have a systems perspective, because you might be doing lots of good, but somebody who is a user of the solution does not necessarily benefit from the solution. So you need to look at the entire system, improve entire system. And finally, in order to be able to do that, you need to find, act, and then measure. So in order to demonstrate benefits of AI to someone who is not even using AI, then you need to have very measurable outcome of your implementation of AI.
Absolutely. And especially on that last point, if you think about healthcare specifically, so the burden on healthcare is massive right now. If you look at margin, those that don't know, health systems have very lousy margin, typically in the single-digit percentage, below 5 would be a typical health system. On the one hand, they're very passionate about improving care. And these are big organizations, typically billions of dollars in revenue, right? Tens of thousands of employees. But on the other, very thin margins. So even if they want to invest in quality and doing what's right for patients, they need to find sustainable innovation models. So the ability to measure the outcomes, both from a clinical perspective, in our case, because we do the clinical side, but also the financial, is really key. It's very complex, but I think that's very important, and maybe different from some other areas of enterprise where they're saying, "Oh, I'll just adopt AI and I'll assume there will be benefits." Here, you have to be a lot more educated about how they operate and how you can actually drive financial value.